Nigeria is a signatory to many international, regional policy frameworks that guarantees women's sexual reproductive health and rights. Despite this, a staggering 76% of women and girls aged between 15 to 49 have experienced sexual violence in their lifetime. 3 of 25 of the surveyed population that suffered rape resulted in unwanted pregnancies. 6 in 10 abortions are unsafe. Only about 12% of women of reproductive age are currently using a modern method of family planning. To enable women, girls, and vulnerable persons make informed choices and exercise their sexual and reproductive health, Ipas Nigeria Health Foundation, in partnership with other consortium members, MSION, PPFN, Thinkplace, and Options, with funding from FCDO, implemented the Women Integrated Services for Health WISH project, with an overall goal to ensure women can safely plan their pregnancies and improve their sexual and reproductive health, particularly the young and marginalized. Ipas Nigeria began the project in 2018 with flagship engagement in Jigawa State. To drive sustainable impact, the project was scaled to be implemented in Borno, Bauchi, Adamawa, Gombe, and Benue states from 2018 to 2023. As a critical first step to strengthening government systems in creating an enabling environment, Ipas Nigeria supported the states on the Violence Against Persons Prohibition Law. In collaboration with our partners in the states, we contextualized and deepened our advocacy techniques to ensure that the sexual and reproductive health components of the law are maintained.
In the coalition, we included government agencies or organizations like Ministry of Women Affairs. They also included people with disability.
All those organizations have interest in ensuring that there must be a law in state that prosecute perpetrators.
The process without the support from Ipas was a bit slow.
But Ipas was able to look at the gaps, the area that we have gap, and they targeted deliberately.
For the push and the follow-up, with the support of Ipas, definitely, of course, the bill get passed, get assented, and more so, Ipas supported the gazetting of the VAB law.
VAB Act law was translated into 3 different languages. That's Hausa, Arabic, and then in Kanuri.
As a result of this engagement, we have a kind of big network between the Association of Persons with Disabilities and other CBOs in the community. I fully feel included in the passage of that act in Jigawa State.
We were having issues with the religious leaders.
We're not able to understand how a coalition works.
Culture is written boldly. It has eaten deep into the community.
With a strategic step that we took to change the narrative on communicating to the religious leaders, it gave us a light that, of course, they really understood what the law is all about.
Ipas supported us to at least have a meeting on coalition building. How do you build a coalition, a network, whatever, this kind of thing.
The impact is, they were carried along.
The law creates awareness within the community. Doing ABC is a crime. Also hiding the information that my daughter, my son, my wife, my sister has been raped, to cover it up. The reporting to the appropriate authorities has also opened. People are now reporting.
The issue of human trafficking among the person with disabilities by taking young person with disabilities out for begging has been voiced out a lot than before.
We established some forums, some small organizations, some associations, so you can call them pressure group of men and women. Whatever happened in the State, they will report it.
So more of sensitization, more of funds to ensure that we enter the local corners of the states to ensure people have an understanding of the law, and then so that implementation could be an effective one for us.
In the efforts to strengthen institutional changes for the implementation of the Violence Against Persons Prohibition Law, we have built the capacity of law enforcement institutions, including the Nigerian Police Force and court magistrates, to understand women's sexual and reproductive health and rights. In the past 5 years, we have built the capacity of 193 police officers and 33 magistrates across the states.
The training provided by Ipas to the police personnel at different stages have been of help to the Nigeria Police Force in Borno State, and that is why it has influenced our turnout, our investigation capabilities, and then the turnout of cases we have been forwarding to the Ministry of Justice for prosecution.
We are able to be mindful of the health of our survivors, especially the female ones, on their reproductive system, and also to make sure that whatever abuse, especially the sexual abuse that they may pass through, their health is very, very important and very paramount to us.
So during the training, I was enlightened to know that I can always advise. They have a choice to either retain that pregnancy or to do away with it.
Ipas training has really influenced my role because as at now, I find it easier to handle such cases whenever they come before me.
I don't use any other law apart from the VAP law.
You know, in Borno we have the new penal code and we have the VAP law. So whichever that is suitable, we will go for it and use it for prosecution of cases.
There was a case that was brought before me. 5 men raped a girl of 14 years. So I have to take these 5 suspects for them to be screened, and it was discovered that one of them is HIV positive and is there languishing in the prison.
Yes, in the training there is a component called referral pathway. Everybody has his own part to play, ensuring justice is done for the victim of such crime.
A survivor have multiple needs, so we need to collaborate, and the Ipas was able to bring all the stakeholders together.
There's comprehensive support between the agencies since my training. I have a good relationship with the media houses, I have a good relationship with the SAC Center, I have a very good relationship with VILDEF, the justice, and all the relevant stakeholders.
When it comes to penal code, then fingering is a minor offense that the perpetrator will maybe only be punished with either 10 months and a fine of 10,000. So that has been a challenge, but because of the new law, we were able to use the VAP law. But the challenge is that most of the officers are not aware of the VAP law.
Through their trainings, we were able to actually, like I said before, help the survivors mentally and also physically. The stigma is something that is very actually hard. It's hard on the girls actually.
The other law, there is no provision for compensating the survivor, but in VAP law, as the case is going on, there's a provision for the survivor to be compensated. So there's a need for awareness also.
To enable legal reforms in bringing about desired change, in reducing gender-based violence, and enabling women and girls make informed choices for their sexual and reproductive health, Ipas Nigeria Health Foundation worked in humanitarian settings to facilitate the development of the standards and guidelines for the medical management of victims of gender-based violence in partnership with the state governments. Healthcare providers and 186 welfare officers have been trained to provide gender-based responsive care for victims of gender-based violence.
Before the development of protocol and the establishment of Sexual Assault Referral Center, we found it very difficult even to assess and treat a victim of sexual and gender-based violence, because most of the time they present at A&E, accident and emergency, or outpatient departments, which is most of the time overcrowded, which means there's no confidentiality for the patient, and that reduces the patient confidence in coming to the facility to access care.
It used to be something that was happening at the background or under the carpet, and people don't used to even see it as a big problem. Despite the fact that we are aware our religious bodies have spelled it clearly, the status of gender-based violence.
Amma daga baya da Ipas ta ɗauke mu ta ba mu capacity building training da kuma standard management da ta ba mu ne yadda za mu kula da waɗanda aka ci zarafi, abin ya ƙara mun daɗa samun improvement ko ci gaba ne yadda za mu kula da waɗanda aka ci zarafi ta hanyar fyaɗe da makamantansu.
The protocol developed for sexual and gender-based violence has been a milestone. It gives us the privilege, the ability to make sure that we have standards that will follow to treat and give effective care for those victims, and also the appropriate file when the need arises.
Yes, plans have always been there, and as far as gender-based violence is concerned, the target is to train all healthcare workers.
We normally attend to sexual assault cases, and after the cases we normally used to issue medical reports to police.
I am optimally empowered as an individual, and I would say that coming from where we started, which was a bit more on a shaky foundation, but following up with Ipas training, I feel that we have really come a long way to provide the desired care that those survivors actually need.
Ba wani empowerment da mu ma'aikata muka samu akan harkar GBV banda ilimi da aka samu na bangaren counseling, ƙarin ilimi akan harkar yadda zaka ba da shawarwari akan waɗanda aka ci zarafinsu.
The challenges are, to me, they're classified into three. The first would be the cultural and traditional practices that otherwise are harmful to survivors.
Ta wani lokacin ana samun matsalar magani ma da za a ba su, wanda za a ba su in an gama musu counseling, likita ya duba su, nurse ta duba su.
Where the personnel themselves need adequate training in terms of their attitude, how to be empathetic to survivors of gender-based violence. Every case we see, we write reports, assuming with a foresight that it can be used as an evidence in court. So, in terms of empowerment, I would comfortably say that yes, I am empowered to do that.
Abin da muke yi shine mai counseling wanda aka ci zarafi, mu tabbatar da cewa baya cikin tashin hankali, mu tabbatar da cewa yana cikin kwanciyar hankali da walwalarsa. Shine role ɗinmu da muke playing.
My role under the VAP law, I play a role of number one, advocacy. We advocate and create awareness that look, such law exists, that if you commit such an act, you are liable to be prosecuted under the VAP law. If I would call on Ipas to do something is to help establish the SAC Center. And I see Ipas being a standout organization that could help achieve that in order to cap up with what it has done in the past and is continuing to do.
To enable mechanisms for the implementation of the Violence Against Persons Prohibition Law at grassroots levels, we worked with religious and community leaders to sensitize them on the Violence Against Persons Prohibition Law. This has empowered them to be agents of change, contributing to preventing gender-based violence. Additionally, we have sensitized communities on the VAP law and enabled women and girls to realize their sexual health rights in marginalized communities. In the states we worked, we have empowered 6,300 women, girls, and community stakeholders in the local government areas on the Violence Against Persons Prohibition Law.
If I'm being violated, or one of my daughter or son is being violated, I have to stand up on my feet and defend our rights.
I have the right to say no. I have the right to report. And I have the right to be fight for.
Ba ma yadda a ci zarafinmu ta ɓangare na ko ‘ya'yana ko wani abubuwa.
Babu wanda yake da haƙƙi
da zai cutar da ni ta hanyar rafin ɗina ko kuma wani abu dai da zai mun wanda zai dinga cutar da rayuwata.
Ya kamata in kare kaina, nisanta kaina da duk abubuwan da na san zai ja hankalin wani gare ni ko kuma ni zan kai kaina gurin da zan samu matsala.
Because we don't want to cheat anybody in our community. If we leave that case, we will cheat our peoples in our domains or in our community. That is why we used to take the case to the police station.
Yes, I will report to police. The reason is to get legal backup.
If I do not support reporting the matters of gender violence to the police, it means I am against the law.
So we want Ipas to expand her scope to include all the healthcare, needs, especially of women and girls.
I'm empowered because I was trained by Ipas.
Ko wajen taruwa, ko na biki, ko a majalis aka, ko a makaranta, muna faɗi musu. Wannan cin zarafi wannan bashi da amfani.
And if the victim is affected, I need to be taken care of. Like I know in the hospital setting, they bleed a lot. And when it reaches that extent that they are bleeding, you can't keep quiet. You have to save that life that is going. And so you'll be able to tell the force men that this is what is happening, so that you alone cannot just be a witness.
Ina samu dari bisa dari. Yanzu abubuwan da sauran da ana yanzu an daina yi ma. To kalubale na fuskanci jawa. Wani ya zo na ya zage ka, wani ya zo na ya ga maka daji magana. To dole kai as da zaka zama mai hakuri, ba za ka bi ta maganansu ba. Kai za ka samu ci gaba da nasara abun da ka sa a gaban ka din.
If you look at the 10 commandments of God, we that are Christians, you find out that when you read it to them, that shall not look at a woman lustfully. Just lustfully is already a sin. And so when you stress that one to them, they understand it. And the Lord said, don't touch. If you stay, there are places they say that if you see anything that is too much, you flee. Don't even walk, flee. So if God say flee, then you have to run away because that thing is very dangerous.
A wajen majalisa sauran mutane suna mai da wannan abubuwa ta wannan ma ci gaba da ma al'umma.
So I want them to be training, especially out of those that they have trained. Let some go to the interior, not only the city, because the work is in these villages.
In recognition of the crucial role of the media as a fourth estate in reporting issues, advocating and raising awareness to creating an enabling environment for sexual and reproductive health and rights, media persons were sensitized and trained on accurate reporting on women's sexual reproductive health and rights.
Ipas training, we have participated in it, and we really improve our skills on how to write stories related to issues on gender violence in Jigawa State.
I play a great role in promoting the implementation of law against gender-based violence.
So conducting advocacy between media and civil society, it's also helped in reducing or trying to inform the policy makers to know what is going on in the society.
Ipas Nigeria Health Foundation has the primary goal to empower women and girls to have bodily autonomy and exercise their sexual and reproductive health and rights. With support from FCDO and in collaboration with our consortium partners, we are moving forward faster to shifting power and ensuring informed choices are made by women and girls on their sexual and reproductive health and rights, therefore contributing immensely to the SDGs 3 and 5.